artery. Okay, so you see here first for the axillary artery we choose the midpoint of the clavicle. This is the first point. Okay, midpoint of the clavicle, and then up to the medial border, medial to the medial lip of the bicipital groove. But how you do know that groove? Usually where this muscle attach. Okay, so at this level.
What is this muscle?
This is a teres major. So up to the teres major. So midpoint of the clavicle up to the lower border of the teres major. Yeah. You see here.
Axillary artery.
Okay. So this is axillary artery. From the midpoint of the clavicle up to the, you can tell in bony things, that's the medial to the medial border of the bicipital groove or lower border of the teres major. This is axillary artery.
This groove, can we like feel it?
Yeah, we can feel it. Just anterior axillary fold. If you just press your finger in the deep of the axillary fold, then you are able to palpate this artery, axillary artery. Okay. Medial axillary fold here. If you press your finger deeply. Okay. Okay. Then from this point, it's mean medial to the medial border of the bicipital groove or the lower border of the teres major, up to you see here the up to the medial border at the elbow, the medial to the bicipital tendon. This is bicipital tendon, bicipital aponeurosis. This is bicipital tendon. So medial to it. Okay, this is brachial artery. Then from here up to this, you see here, this is the styloid process of the radius. So this is medial to the styloid process of the radius. This is radial artery. Okay, and from here up to the you see lateral to the pisiform bone. This is ulnar artery. So artery we finish.
Okay.
Yeah? Now nerve. So median nerve. Median nerve in the upper arm, it's lateral to the brachial artery. Okay.
Lateral?
Yeah, lateral to the brachial artery. Then in the lower arm, it medial to the brachial artery. Because if first lateral, then it come into the medial. Okay?
Doctor, this is the median or the axillary?
No, this is median.
Median.
Median nerve. Then you see here at the wrist. At the wrist, we tell the flexor carpi radialis tendons just is medial. So medial to the flexor carpi radialis tendon at the wrist. This is median nerve. Now radial nerve. So radial nerve, just sorry, artery we finish. Now nerve.
No nerve.
Yeah, along the radial artery. Okay. So you can draw a line from the acromion. You see, this is acromion.
Where is the coracoid?
Coracoid is sorry. Acromion is, you know, the glenoid cavity. This is clavicle. So yeah, we can feel it here. We can feel it. This is acromion. Okay, this is acromion. Coracoid is just lower of this. Coracoid is just below of the acromion. Acromion is the topmost. So from the acromion, we draw a line up to the adductor tubercle. Okay. In the bony aspect, you can feel it. Okay. So from the acromion, you see here, this is acromion. So the top of your shoulder. So this is the acromion up to the adductor tubercle. When you draw a line, then it's upper 2/3 or upper 3/4 is posterior. Okay?
We have an adductor tubercle in the upper limb.
Sorry. I'm so sorry. The medial lateral epicondyle. Okay? Lateral epicondyle. So this line, it's upper 3/4, it lies posteriorly. Okay. Then at the elbow, lower 1/4, it come into anteriorly. Okay. Here up to this the radial. Okay. Then in the forearm, just in the snap box. You remember in the wrist, just only snap box. Snap box. Up to this, the radial nerve. And now ulnar nerve. So,
Doctor, it finishes at the snap box. خلاص.
yeah, snap box, then it sends superficial and deep branch. Superficial branch is cutaneous, but we are not going to talk about these things. Okay? So up to this, you have to know now for the surface anatomy. And then ulnar nerve. So ulnar nerve, it's medial to the median nerve. Okay, it's medial to the median nerve in the upper arm. Then in the elbow, behind the medial epicondyle. Okay,
It's medial to the median nerve.
median nerve in the upper arm.
Okay.
And in the elbow, it's behind the medial epicondyle. Then at the wrist, it's the same, the ulnar artery, lateral to the pisiform bone. You see here the ulnar artery and ulnar nerve in the same place. So when you just memorize the things regarding ulnar artery, then you are able to draw also the ulnar artery here, ulnar nerve here.
Doctor, they are lateral to it or medial?
Lateral.
It's lateral, but pisiform to no, lateral to pisiform bone.
They are lateral to
Pisiform bone. Both are lateral to pisiform bone.
But so median to the.
Yeah, but it's median to the artery. Okay, but you just remember lateral to pisiform bone. Just okay. Ulnar artery, and then the lymph node. 3 groups of lymph node. We know here. This is the
Supratrochlear.
this is olecranon. This is medial epicondyle. So just above the medial epicondyle. Here the supratrochlear or cubital. The same lymph node.
above the epicondyle.
This is medial epicondyle, so above this. Okay, just above. Okay. So here, this is medial epicondyle, so above this. Here, supratrochlear or cubital. Okay. Then here, just deltopectoral group. This is pectoralis major muscle. Okay, and this is deltoid. So you see here, there is a group here. There is a group here. So at this level, this is
Deltopectoral.
deltopectoral group.
يعني where the pectoralis.
Pectoralis major and deltoid muscle, they meet. Okay, there is a group here.
Doctor, we can feel it, right?
No. We can feel it because it's deep. It's deep. We can feel it. If there is infection, it enlarges, but it's deep. Usually we feel these things.
So we can feel it.
We can feel this group if it is enlarged.
So
If it is enlarged, otherwise we cannot feel it. Okay. So
So this is pectoralis major.
sorry. Yeah, this is pectoralis. So this is delta. No,
Deltoid is here, but it's not.
yeah, it's not here. So usually the group is here in the picture. You just remember pectoralis major come and deltoid. So there is a group here.
Okay. بينهم.
Yeah. So the group in between that, and then axillary group. This is axilla. Okay. This is axilla, but it's easy to feel in your body along the axillary fold. Anterior axillary fold, anterior group, along the posterior axillary fold, posterior group, and the lateral group.
Even if it's not inflamed, right?
No, yeah, normally we cannot feel it.
But
Most of the lymph node we
if you
cannot
push
feel
it
it. Just
inside-
only inguinal, sometimes we can feel it. But other groups usually we are not able to feel it if it is not enlarged. Clear?
Okay.
Okay. So upper limb we finish. Okay.
Lower limb.
Now lower limb. Lower limb just give these things. Yeah.
Okay.